Hello, my name is Sakai. I'm a level 2 nursing student.
Uh-huh.
My clinical instructor has assigned me to observe you today.
Hi, Sakaya. How are you doing today?
I'm good. Excellent.
Okay. Do you need a report from me, from a patient?
Thank you so much. I look forward to learning a lot. So you're taking care of the patient in room 620. Do
Yes.
you have time to give me a report?
Yes, definitely. Uh, the patient name, he is Mr. Reader King. He is a 67-year-old male with a 20 years history of type 1 diabetes, and client complained of non-healing wound on a right heel, high blood sugar. Actually, his father died of myocard infarction at the age of 53, and mother died of lung cancer at the age of 78. Um, the patient doesn't have any no known allergy. The patient is on a full coat. The height is 5'11" and the weight is 171 pounds. As I told you, the primary diagnosis is a stage 2 diabetic ulcer on right heel. So the patient has a pressure ulcer on the right heel on a stage 2, and the secondary diagnosis is diabetic mellitus type 1. The hemoglobin A1C, which was checking 3 weeks ago, it was 5.2%, which is good. We want to keep it between 4 to 6%. For the neuro, the cranial nerve 2 to 12 are intact. Patient is alert and orient times 4. Qualitative deficit is being able to identify sensation with pinprick to bilateral lower extremity. For the respiratory, the lungs are clear to auscultate. Breathe on labor without accessory muscle use. On the cardiovascular, S1, S2 heart sound appreciated without murmur, rub, or gallop. Regular rate and rhythm, no bruit. For the GI, abdomen flat, symmetrical, soft, no tenderness. Bowel sound present times 4, times 4 quadrant, and no bruit. For the genitourinary, the patient doesn't complain of anything. Self-voiding. Actually, for the vital sign, which was the last one, which was checked and today at 16:45, the respiration is 16, pulse 76, blood pressure 128/70, and O2 saturation 96%. The patient has a IV on the right median vein, and there is no complaint at this time. It is clean and dry. When we go inside, we are gonna look. And the thing that we definitely check it before giving the medication to the patient was blood sugar. The blood sugar for this patient at 16:45 was 290, and the doctor said that if the blood on the doctor's order, under the physician order, if the blood glucose goes between 241 to 300, we are going to give the 16 unit insulin to the patient. So this patient blood glucose is 290, and then I'm going to give the 16 unit insulin to the patient. Okay.
Thank you so much for giving me a report. Do you
Actually,
mind if I ask
go ahead.
Do you mind if I ask you a couple of questions regarding the medication administration?
No problem.
Then watch you demonstrate giving the medication to the patient?
No problem. You can ask me.
Why specifically is the client receiving this medication? What action does the medication have on the body?
Actually, right now we are gonna the physician ordered the regular insulin for the patient. That the regular insulin is an anti-diabetic agent that it increased blood glucose level by decrease blood glucose level by increasing the cellular uptake of glucose and stimulate storage of glucose as glycogen and inhibit release of glucagon. We use it to maintain blood glucose level within the normal limit, which is gonna be between 70 to 100. It promotes cellular uptake of glucose, amino acid, and potassium, promote protein synthesis, fatty acid storage as triglyceride. And the regular insulin, the onset is 30 to 60 minutes, which means that when we give this one to the patient, we want to be sure that after 30 to 60 minutes, the patient get the meal, and the peak is 1 to 5 hours. It means that we have to look for the sign or symptom of hypoglycemia at that time. If the patient get headache, confused, get the calm and clammy skin, or agitate, those are the signs of hypoglycemia, and has a duration of 6 to 10 hours. Do you have
All
another
right.
question?
When should you question administering this medication? And does the medication have a therapeutic serum level?
Actually, if the blood glucose goes under the 70, we are gonna stop the medication and at the same time call the physician. But if it is high, like for this patient, which the blood glucose is 290, yes, we are gonna administer the medication.
All right. What vital signs do I need to monitor before administering the medication?
Actually, as I told you, we have a vital sign. We have a temperature, pulse, respiration, and the blood glucose. As I told you, the temperature is normal. The temperature is 98.2. The respiration is 16, pulse is 76, blood pressure is 128 out of 70. All of them are normal. The only thing which is our concern is the blood glucose, which is 290, and then we're gonna administer the medication for that problem.
All right. Thank you so much. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Actually, I'm gonna explain the sign or symptom of hypoglycemia definitely to the patient. If the patient get a headache, get a tingling in a finger or toes, become agitated, or get a sweating, or get a like cold skin, that's the sign of hypoglycemia. I will definitely ask the patient to notify the nurse of those signs if he had, or any sign of hyperglycemia, which is going to be polyuria, polydipsia, there's going to be polyuria, polydipsia, and polyphagia, or flash and dry skin, like acetone breath. I'm going to teach the patient those two, so to notify the nurse.
How will you know the medication is effective?
We are going to monitor the body weight. So if it goes higher than the thing that the patient has, maybe we need more insulin, we should consult with the physician. Monitor the blood glucose and ketone every 6 hours during the therapy. Control of blood glucose level without any sign or symptom of hypo and hyperglycemia. It shows that the therapeutic was effective.
All right. Thank you so much for answering my questions.
You're very welcome.
Do you mind if I watch you before you give the medication to the patient?
Oh, no, not a problem, definitely. Actually, I think that I told you about the side effect of the medication, which is going to be hypoglycemia, irritation after injection site, we should look, and weight gain, and hypokalemia. Okay, and then we are going to definitely teach the patient that the patient should carry a source of glucose for unexpected episode of hypoglycemia, wear a medical alert bracelet to explain his condition. Okay, so what I'm going to administer now as I told you here, it says that blood glucose between 241 to 316 units we needed. And the blood glucose is 290, so we need 16 units of blood glucose. I'm gonna wash my hands. I'm gonna put on my gloves. This is a regular insulin. The check number 1, when I'm taking out of the drawer, I'm gonna check it with the MAR insulin regular. Okay, and then check it with the patient name, Mr. Reader Kent. Yes. Okay. I'm gonna click this one. So 16 units. I'm gonna put the 16 unit air to the insulin. Okay, as the insulin is supposed to be checked with 2 nurses, I want you to check this one. This is 16.
Yes.
Okay, I'm gonna put the air here and the insulin, and then I'm gonna draw back 16. You want to look? This is 16.
Yes, very good.
Okay, and I'm gonna do the one hand capping for the safety. Okay, we are ready to go to give the insulin to the patient. Okay,
All right.
knock knock. Mr. Ruben, hello. How are you doing today? Very well. My name is Mahsa. I'm gonna be your nurse today, and I have a level 2 student nurse, Sakana. Is that okay?
Hi, Isabel.
Okay. Let me wash my hands first. How are you doing today?
Not bad.
What is your pain level now?
About a 2.
And your right heel?
It's alright.
And your pressure offset? Okay. You have actually IV on your right side that I'm going to check to see if it is any irritation, edema, nothing. Do you have any pain here around the IV side?
No pain.
No pain. So, another question. Do you have any allergy?
No.
No? Actually, first of all, we're going to ask you your first name, last name, and date of birth, please.
Ryder Kind. Date of birth is 1/1/48.
Oh, thank you. Right patient. So I'm gonna look at your right. Okay, you are on a consult. Look good. It look a little bit pink, but you are on a consultation for the wound care nurse. She's gonna be here shortly to look at